Well, now let's look at the impact the coronavirus could be having on people and their state of mind amidst this period of uncertainty. Experts saying the virus and fears around the spread present new mental health challenges, even for battle-hardened Israelis. And being in quarantine can't help either. The question is, are people equipped emotionally for the new reality? Well, for more insight on our state of mind right now, we welcome clinical and organizational psychologist Dr. Zohar Rubinstein from the Faculty of Medicine at Tel Aviv University and at the IDC in Herzliya, and he joins us now from Petach Tikva. Dr. Rubinstein, thank you so much for your time. Israelis, as you know, are resilient. They're used to tough times in the past, times of war, rocket fire, racing to shelters when sirens go off. Talk us through why this period of uncertainty right now, and for many people, this partial lockdown could be so difficult.
Well, I think the simplest answer to that is that we are witnessing a total new experience that is not part of the history of Israel, or I may say to the whole world. It's of course a disaster situation, an emergency situation, but definitely not something that we know. And there are two reasons that actually even make it even worse. First, an anxiety from the corona itself, which is an anxiety from quite unknown, because corona has a very specific characteristic that the symptoms are being discovered only 2 weeks after the infection takes place. And the other is, which is something that perhaps overlooked these days, but I think people try to realize it more and more, is the anxiety, the terrible anxiety of the consequence of the economic aspect. And these two major factors, together with the fact that not only that we have to deal with them, but also, and this is something very important, we are, instead of transferring all this anxiety into action, which is something that is in itself is something very strengthening, we are asked to sit in a quarantine, to sit isolated at home. And this is, of course, if we remember the stress response, which is either escaping, fight or flight, we can actually do neither. We have to sit, in a way, quite passively. And all these things together, all these factors together, coming in a very specific time, with immense uncertainty, because every hour can reveal something totally new, is of course something that we should say is the reason for such a reaction.
So, Doctor, as you mentioned, this anxiety, we're seeing it, we're witnessing it. We saw people panic buying in the beginning. You talked about the uncertainty financially. What advice would you give to people who are taking strain right now? For some people, being confined with family can be quality time. It can be positive, but not for everybody, as you've described. So what advice would you be giving right now to people who are taking personal strain?
Right. Advice will be difficult, but I think it's the only one. It is coming from, I would say, certain awareness that perhaps many people are not acquainted with. And this is awareness that we are facing a kind of junction in which we have two major options. One is to go about how we normally respond to such a situation and allowing ourselves to get mad. And the other is to, even in a way that we are not used to strengthen ourselves into a kind of thinking that this is, of course, an abnormal situation, yet it calls for a definite different thinking, a kind of challenge, a kind of trying to see, as we are in this situation and we have so little control on it, what can we do that can even makes us stronger or even grow in a process of growing. But this junction, this kind of decision, which with either going to one side or the other, is, I think, a crucial point of departure.
Thank you so much. And I guess we are all going to have to get used to adapting to this new so-called normal for now. That's clinical and organizational psychologist Dr. Zohar Rubinstein from the Faculty of Medicine at Tel Aviv University and at the IDC in Herzliya, speaking to us from Petach Tikva. Thank you so much.